Pregnancy is a unique, exciting time in a woman's life, as it highlights the woman's amazingly creative powers. Healthcare providers were concerned about mothers' thoughts about how to take care of themselves and their baby. So, as a nursing students, we are going to present relatively comprehensive coverage. It will hopefully introduce you to some new ideas of antenatal and postnatal care and help you to learn more about aspects of pregnancy that you may not have previously encountered.
Antenatal care refers to the care that is given to an expected mother from time of conception is confirmed until the beginning of labor.
Breastfeeding. Breastfeeding has many health benefits for both the mother and infant. Breast milk contains all the nutrients an infant needs in the first 6 months of life.
To maintain a healthy pregnancy, approximately 300 extra calories are needed each day. These calories should come from a balanced diet of proteins, fruits, vegetables, and whole grains. Sweet and fat should be kept to a minimum. A healthy, well-balanced diet can also help to reduce some pregnancy symptoms, such as nausea and constipation.
Tips for the 24 hours. For some mothers and babies, breastfeeding goes smoothly right from the start. For others, it takes a little bit patience and some help to get things going. Here are some tips for breastfeeding in the first 24 hours.
Try to breastfeed within the first hour after your baby is born. Your baby is more likely to be awake and take the breast.
Be persistent and consistent. Even if your baby doesn't impress you with a full feeding right away, take what she gives you and see what happens at the next one.
Spend time in direct skin-to-skin contact with your newborn, since it can encourage your child to breastfeed more.
Refrain from giving your baby a pacifier. If your baby is crying or looks interested in sucking, you can put her to the breast instead.
Keep putting them to the breast every few hours. If your baby is sleepy, even if you have to wake them, wake up. And remember, newborns become much more alert and breastfeed better as the days go on.
Talk to your nurse or a lactation consultant. If you are worried that your child isn't getting enough to eat the first day, your colostrum is all your baby needs in the first few days of breastfeeding, and it increases each day until your breast fill up with milk by about the third day postpartum.
Regular exercise during pregnancy can improve your posture and decrease some common discomforts such as backache and fatigue. Most exercises are safe to perform during pregnancy as long as you exercise with caution and do not overdo it. The safest and most productive activities are swimming, walking, and indoor stationary cycling.
How to do it? Imagine you are trying to stop the flow of urine or trying not to pass gas. You are contracting the muscles of the pelvic floor. Try not to move your leg, buttock, or abdominal muscles.
Here is what you need to know about postpartum care for your changing body. First thing is vaginal healing. For the first 6 weeks or so after the birth, your uterus sloughs its lining, causing a vaginal discharge called leukia. At first, it's just like a heavy period, gradually decreasing to a light discharge.
Prenatal care. If you had a tear or a vasectomy during the birth, you will have stitches that can be uncomfortable while they heal. Even without stitches, the area around your vagina, the perineum, may feel bruised and swollen.
To speed healing and ease discomfort, keep the area clean with plain soap and water during a regular bath or shower.
Do Kegel exercises, tightening and releasing the vaginal muscles to speed healing by increasing the flow of blood to the perineum.
In the first few days, an ice pack can help reduce swelling.
Allow air to circulate by going without a pad for an hour or so each day. Use old towels to protect your bedding while you lie down for a rest.
If you are pregnant, you might be getting a lot of advice from well-meaning people. You might be asking whether what they say is true.
They say when you are pregnant you need to eat for two, but it is a myth. Carrying a baby does not require you to double your caloric intake.
Exercise during pregnancy will send you into premature labor, and that's myth for sure. The truth is exercise helps you manage the discomfort of pregnancy and increase your chance of having a vaginal delivery.
Eating peanuts and dairy can make your baby allergic to them. For sure, it's a myth. The truth is, perfectly safe to eat these foods unless you are allergic to them, or if your doctor advises you not to.
A pregnant woman shouldn't drink coffee. You can drink coffee. This is one where moderation is the most important thing.
Pregnant should avoid sex during pregnancy. Sex during pregnancy does not increase the risk for preterm labor and low-risk pregnancies.